I'm going to London to the Digital Pathology and AI conference, my last conference of the year. And this episode is a recap of what happened in the digital pathology world in 2025.
Learn about the newest digital pathology trends in science and industry, meet the most interesting people in the niche, and gain insights relevant to your own projects. Here is where pathology meets computer science. You are listening to the Digital Pathology Podcast with your host, Dr. Alexandra Jura.
This is the last day of 2025, and I wanted to share my recap of the year from the last conference I attended, the Digital Pathology and AI by Global Engage. Before we dive into it, I so want to thank you for accompanying me on this digital pathology journey, whether it's your first year in digital pathology or your 10th or I don't know which year. You are my digital pathology trailblazer. Thank you so much for every minute watched, every like, every comment, every download of this podcast. Your trailblazing journey is advancing this field. So let's celebrate the end of the year and keep advancing digital pathology in 2026. And here are my end of year thoughts from London, from Global Engage Conference. 2025 is coming to an end, and I already have my bags packed for the last conference of the year, the Digital Pathology and AI in London. But before we dive into what I'm going to be talking about there, let's do a 2025 recap. We're going to start with regulatory and guideline level AI. Then we're going to look into clinical trial tools, move into hardware, including direct to digital imaging and fluorescent imaging, and software, obviously very often AI powered, and conference highlights from the conferences I visited this year. Okay, I knew that London Luton is not the biggest of airport, but how do I even get out of here to go to London? Okay, there's food, there's some coffee, we're good. They have this like normal food here in this airport supermarket, like some onions, Spanish tortilla, mozzarella. That's an interesting choice for travelers. Like a full spaghetti, carbonara. I assume they have some microwave or something, or maybe you have to take it home with you. That's your food for home. I love traveling. Even little things like that, they make me so happy. Let me find something easy that I can eat right now. Maybe mozzarella and water, and we should be good. And then a coffee. I'm going to be meeting a friend today, and he told me where to take the train to. But before you continue with the travel, we drink coffee, and let's talk about digital pathology in 2025. And let's switch off Meta glasses that randomly switch on an audiobook that I'm listening to. So in 2025, there was a big achievement, I would say. I don't want to call these things shift from non-regulated to regulated, because it's one approval clearance or de novo application at a time, but there was one super important, and that was Artera AI Prostate. I saw press releases, but then when I went to the NCCN AI and Cancer Care Summit in DC, in Washington DC, they are actually in the NCCN guidelines. Later I met the team at a different meeting at the Lumea Digital Diagnostics Summit. So they are in the NCCN guidelines, and this is a super achievement, because if you're not in the guidelines, you're not going to be used as a test. So this is a multimodal tool that looks at biopsy images and clinical data, clinical information, and predicts long-term outcomes like developing distant metastasis or dying from prostate cancer in the next 10 years. And in August 2025, FDA granted them de novo marketing authorization for as software as a medical device. And this is the first tool that provides this kind of prognostic information in the digital pathology world. So that means that Artera test can be used to help doctors determine the treatment, whether it should be aggressive treatment or maybe less aggressive or no treatment. And kudos to them for going the de novo route, because now It's a new category of products, and others can basically follow their footsteps. They are pioneers, they are the trailblazers, and obviously every single digital pathology company that gets to a regulatory milestone is an example and a trailblazer in this space. Another category of regulatory green light comes to, let's call them digital microscope, because several platforms received the 510K clearance or expanded the existing one for primary diagnosis. So Path AI Site DX was cleared as an image management system for specific scanners and with a change control plan to add new scanners, which is also, I don't want to call it a trend, like a possibility where you can have this predetermined a plan that you're going to make changes, and then it goes faster to add, for example, scanners to be compatible with your software for primary diagnosis reads in an image management system. Then we had Indica Labs Halo APDX that was cleared with the Aperio GT by Leica, and Indica and Leica are working closely together. There's going to be more about that because we will be working together with Indica Labs again. I'm super excited that they're joining the sponsors of Digital Pathology Place. There's going to be a dedicated podcast episode on that, and I'm going to visit them at their user meeting group and ask them all about it. So stay tuned for that. Then we had other pulse light imaging systems like Roche's Digital Pathology DX solution. We already talked about that, and we have a video, and shout out to Roche as well. Then Page's full focus viewer. Page got acquired. That's a big deal in the digital pathology world. Tempus acquired them. Then Lumea Viewer Plus. I'm going to tell you about Lumea Digital Diagnostics Summit that I went to for the second time. Procia Concentric APDX and Path Presenter's Clinical Viewer. You may have seen the educational platform for Path Presenter, but they have a full-blown clinical solution, and they got an FDA clearance as well. So big milestones. Shout out to those trailblazers. You guys are amazing, because now pathologists can choose whatever works best for them and can serve their patients faster. And I believe that patients deserve fast diagnosis, and digital pathology is the gateway to fast diagnosis, and now we have so many tools that are compliant, so this is amazing. There's also a lot of advancement in the clinical trial and research use only aspect of digital pathology. I'm gonna get to London first, and I'm gonna talk to you about it after I get there, so let me find a train. Okay, I've got train tickets. My train ticket person was from Poland, so we talked Polish, and there are buses from here, there are trains, and the train goes to King's Cross, and this is apparently very close to my hotel, so I will do that right now. Okay, words of wisdom from London. It's okay not to be okay. We don't have to be okay all the time. I am saying that because I'm okay, but I'm freaking jet lagged and tired, and it's end of year exhaustion, guys. So if you don't see my usual high energy, it's gonna come back once I start sleeping, because I just came from the US on Sunday. Today is Tuesday. On Monday, I didn't really sleep because I went to sleep early, and after 3 hours, I was awake for another 5 hours, and then I had to wake up at 4 to go to London. So it's okay not to be okay. So in addition to the regulatory milestones, 2025 was big for clinical trial work and research use AI work. So here a big deal is the AstraZeneca quantitative continuous scoring for the TROP2 marker for non-small cell lung cancer. At this moment, it's research use only. It analyzes individual cells and computes a ratio and generates a continuous biomarker score from the ratio of the TROP2 biomarker in the membrane and in the cytoplasm of the cells. So something that visually a pathologist can confirm but cannot really compute a continuous score of that sort. So in retrospective study, this score did a better job than the visual scoring. There was also a clearer difference in progression-free survival when patients were stratified with this qualitative continuous score, QCS, qualitative continuous score. So this is not yet approved, it's not being used in patient care, but the potential is huge, because suddenly we have something that stratifies better where you don't have a visual counterpart you can compare to. So we're entering a new way of diagnostics that can be verified by a pathologist but cannot be reproduced visually by a pathologist. And this will change how we run clinical trials. This is gonna catapult digital pathology into the clinics and into the clinical trial world. So I heard about this the first time also at the NCCN AI in Cancer Care Summit. No, actually I already heard about it last year at Lumea's Digital Diagnostics Summit, where they started this work, and then at the NCCN Summit they were reiterating, and I was excited because it's the first time where you cannot say, no, digital is actually nice to have and we're going to keep doing it visually. No, there is no way to do it visually. Now I have to focus where to get off this train.
I am in the right place. Apparently London St. Pancras. They have a St. Pancras in London. It's the same as King's Cross, but I have to cross the road to get to King's Cross. So let me do that.
Looks like I can walk to my hotel. So let's try it. It's 2.3 miles. Not that bad, just like all the way straight. So let's talk about the news in hardware. Other than more scanners cleared with more viewers, well, viewers are software, but this one technology that I am still fascinated with, and I joined them at USCAP, is Muse microscopy, the direct to digital imaging. And I am very curious where this is gonna go in 2025, because that has the potential to change how we do pathology, because we will no longer need glass slides. You will be able to create digital images directly from the tissue. So, and if you want to do formalin fixed paraffin embedded after that, you can, but basically instant diagnosis, instant imaging after getting a biopsy. And this opens access to tissue diagnostics for places that don't have labs, that are remote, and basically everywhere where there is no access to pathologists, this technology could give access to immediate, instant pathology diagnosis. Because if you create a digital slide, then you can send it to a pathologist, and you can also have it diagnosed in no time by somebody who's remote. Next thing, fluorescent multiplexing. I joined Hamamatsu at SITSI recently that was November, I think, and they were launching their fluorescent scanner, which can scan up to 10 plex, 10 different markers. But the highlight was the talk that Carlo Bifulco gave. It was a talk sponsored by Hamamatsu, but the message was that in the era of personalized medicine, the more insights we have, the more we know about biology, the more sophisticated methods we might need to use to actually be able to provide the diagnosis. So he was showing how much more precise, more reliable these markers are compared to some IHC markers. But the bottom line here is it's not going to be the only thing that's going to be happening. And all the older methods are no longer good enough. We're not going to be doing H&E, not doing IHC. No, this is going to be something additional, like the qualitative continuous scoring from AstraZeneca. All the other scores are still going to be in use, but we are discovering new biology, and for being able to leverage this information we are discovering new biological insights, and to get to those insights, we will need new methods. One of the methods is going to be computational pathology. The other may be multiplex immunofluorescence. AI and foundation models. Foundation models continue to be part of arsenal of new pathology tools. And what's happening now, these foundation models are entering commercial software. So for example, Aphoria is now leveraging foundation models for customized image analysis solution that you can design on your own. And these foundational models that are already pre-trained to recognize histology, recognize pathology structures, recognize different types of cancer, foundation models. And then agentic AI, another thing that's happening. That already started in 2024, but now more and more companies are leveraging this. Modela AI being one of them. Beagle by Histofy is another tool for toxicological pathology, for streamlining toxpath workflows. And then PathPresenter has large language models incorporated in their clinical platform to make life for pathologists easier and the diagnosis for patients faster. So this is being more and more integrated. It started last year. Now I see this being actually leveraged. And highlights from conferences. Now on my way to the hotel for DPAI London 2025. But before that, I went to Sydney with Hamamatsu. I already told you about that. Learning more about the world of multiplex IF, and we're gonna have podcast episodes about that. This was fascinating, seeing like how this multiplex IF world like functions from like tens or thousands of biomarkers. You then narrow it down to the ones that are more relevant, and you have specific machines for everything. So I was fascinated with that and was interested in seeing what offering Hamamatsu has. They have 2 different scanners. They have the Moxiplex that we featured at SITSI, and they also have the S60. So we're going to be talking more about that next year. Path Visions before then. Path Visions was very patient-centric. I loved that it was bringing digital pathology to the patients, having digital pathology be leveraged to help patients. And there were stories of pathologists who I had the honor to interview on my podcast. For example, Dr. Lydia Joseph and Dr. Marilyn Bui. They both gave talks about the patient-centric pathologists, how they're actually interacting with patients, how they create this bridge, this very personal bridge between the report, the information, the cancer biology that people are bombarded with when they get diagnosed with cancer, and the treatment, and how they're explaining this disease to them. So that was Path Visions with patient centricity, with collaborations of, for example, Path Presenter and Grandium. I was there with Barco, who has digital pathology optimized monitors, and I was featuring Grandium new 4-slide scanner, super compact and high quality imaging. And also we talked with Peter O'Toole from Mtuitive about how structured data are still important even in the era of large language models that can work with unstructured text. You can achieve so much more if your data is actually structured. So this is still the base of good computation, of good AI, good data. That was Path Visions. ACVP, American College of Veterinary Pathologists, I gave a talk about how to make sure that we create reliable and liable AI, and I'm gonna make a separate video from my presentation for you. But basically the message there was, it's no longer like if we want to deploy a tool that's used in an institution, so it's not going to be one person's effort anymore. It's going to be a group of experts, and not a single person from this group of experts is going to be able to reproduce all the effort. It's going to be group effort from people from multiple disciplines, and this is also something that we talked about on the podcast with Andrew Janowick, who published a paper on how to deploy digital pathology tools in institutions. In the summer, there was STP, that's also my Veterinary Pathology Conference, Society of Toxicologic Pathology, and there the topic was neuropathology. And my talk was on digital pathology used in neuropathology. And in veterinary pathology, it's not yet that popular for diagnostics, for primary evaluation, although in the MD pathology world, several institutions went fully digital, including Ohio State, where neuropathology, I think, was one of the first subspecialties that went fully digital. So they are totally confident in the digital images for neuropathological evaluation. Veterinary pathology world is a little bit divided. I belong to the camp that believes in it, and not only because I know it's good enough, because I've seen the studies on the scanners and how and the validation studies for the FDA for these machines, and basically all these machines are now good enough. But the biggest advantage of digital pathology for any type of drug development and drug discovery work is the option to be able to use algorithms on digital study material. So switching to digital study material opens doors for new discoveries, for interinstitutional collaboration. This is something you cannot do on glass slides, and it's really important for drug development, and it requires change management to bring more people on board. I believe this is going to change the game. And also
when pharma companies like AstraZeneca, we already talked about it, do it in the clinical world, it's going to be expected in the preclinical as well. So I'm looking forward to this being the main way we do neuropathology. And not only neuropathology was the topic of the STP, but all different kinds of pathology. And whenever quantification can be done, we should do quantification and not guesstimation. And quantification can be done with digital algorithms. And the last thing that I'm pretty proud of in 2025 is that we kept going with the DigiPath Digest. So DigiPath Digest is a weekly abstract review, abstracts about digital pathology and AI in medicine. We started venturing into AI in medicine as well. And every week, my digital pathology trailblazers are joining me at 6 a.m. in Pennsylvania. Most of the time, I'm doing it from Pennsylvania before my kids wake up. And we go through the abstract that come out this week. This is from PubMed Alert, so it's peer-reviewed literature. We're doing these journal club live streams. Then whoever wants to listen to them on the podcast, they can do that. Whoever wants to watch the video, they can do that as well. And there are a few people that are regularly joining me live at 6 a.m. So that makes me keep going. That makes me feel that you want to learn more about digital pathology. And that shows me that adoption begins with knowledge, not with infrastructure. And this is going to be also the topic of my talk tomorrow, of my keynote. It's going to be about how knowledge empowers digital pathology trailblazers to advance digital pathology, and how anybody can start right now without any infrastructure, just by basically committing to acquiring this knowledge, diving deep, committing to regular process of acquiring knowledge, because this space changes very fast. So it's not going to be, I'm going to read one book and then I'm going to know about digital pathology. No, next month there's going to be something else. In 2 months there's going to be something else. That's why we're doing those journal clubs every week. But if this does not resonate with you, that's okay. Just pick something, because what's going to happen, maybe you are at this conference and maybe we're going to see each other, and maybe we're going to talk and you're going to be very motivated. But then what's going to happen, Christmas is going to happen, it's going to be a busy time, New Year's is going to happen, and we're going to be back to work. And there are two options. Either nothing's going to happen because the conference enthusiasm is going to fade and you're going to be back to what you're doing, or you're going to figure out what you're committing to. And if I can see you at the DigiPath Digest on one of my Fridays, that would be amazing. But you figure out what you want to commit to. There are different options. There are webinars, there's digital pathology associations. There's a lot of resources. So pick your thing, commit, and next year we're going to have a totally different conversation. A lot more sharp, a lot more to the point. You're not going to be overwhelmed anymore. You're no longer going to be asking where to start, because you're going to be on your way. The first tip I'm going to recommend tomorrow, and I'm recommending it to you today, is the book I wrote and I'm updating right now, Digital Pathology 101, all you need to know to start and continue your digital pathology journey. So go ahead, grab it from the link below, and I talk to you in the next episode.